In fact, to keep focus on the same, I earlier spoke to Dr. Ishwar Gilade, Secretary General, Organized Medicine Academic Guild, OMAG, about the rise in dengue cases, the concerns, and of course, precautionary measures to be taken. Let's listen in. Doctor, thank you very much for taking the time out and joining us here this evening on Mirror Now. As we speak about this, let me begin by asking you this. There are, of course, many myths about dengue and surrounding the same. If you could begin by busting those for our viewers. Some of the most common ones being any mosquito can carry a dengue virus, and dengue mosquitoes bite only during the day.
Dengue mosquitoes are large mosquitoes, which are called Aedes aegypti, and they can cause either dengue or they can cause chikungunya. Whereas the malaria mosquitoes, they bite in the night time. So dengue mosquitoes 2 hours after sunset, or 2 hours before, 2 hours after sunrise, and 2 hours before sunset. And even during the night when there is a light, full lights are there, then dengue mosquitoes can bite. The most common myth is that as soon as dengue is diagnosed, people start worrying about platelet count, and platelet count can go down to less than 100,000, less than 50,000, and people start panicking and they get admitted only for platelet count. My advice to those people is platelet count be managed till 5,000 to 10,000. There is no need of platelet transfusion. Unfortunately, there is no treatment for dengue, and therefore the only management is hydration. Provide good hydration, provide medicine for fever, body ache, etc. And if there is a vaccine, currently there's a vaccine called dengue seal, which has been already through in phase 1 trial in Australia. This is made by Serum Institute. The trial was done in Australia because for phase 1 trial, you need people who are never exposed to dengue. And therefore, you are doing in a population which is virgin to dengue, and you can find out whether it is safe or not. So phase 1 is very successful. Phase 2, 3 together, it will be done. It is being done in collaboration with ICMR. If that vaccine is found effective, and that will be cost effective also because it's a Serum Institute vaccine, and we have known that Serum Institute provides at low cost. There are 2 other vaccines available, but they are not amenable to Indian strains of the dengue virus. And they are 2 of them are called Q-Denga, which is used in Indonesia, UK, and Europe, and Brazil. And there's a dengue vaccine, which is used in America and UK, and Europe. But these vaccines are not available in India. They are not amenable to Indian type of dengue virus. Now, what is most important is this Aedes aegypti. They feed on stagnant water, and that stagnant water is very common during the monsoon. And a lot of people also keep at home some kind of stagnant water for their just decoration, and they don't change the water for a long time. And then these kind of mosquitoes, they feed over there. So we need to do a very good mosquito management. We need to do during the monsoon season, wherever there are halfway constructions are on, people go in court and the construction is stopped for some reason or the other, and there's a stagnant water. All such stagnant water, they are breeding ground for this Aedes aegypti. So we are currently discussing only dengue, but one of them is most disabilitating disease is chikungunya. People get chikungunya, and for lifetime they have to suffer with the joint pain whenever some kind of reactionary behavior is there. So we need to manage this Aedes aegypti, the good mosquito management, and unfortunately it is seen in the poor areas where people are economically unfortunate, and low hygiene areas. So we need to protect those people. They have no access to mosquito nets. They have no access to mosquito repellents. They have no access to kind of mosquito management. And therefore, the fogging, etc., these are done sometime, but they are not enough. And we need to do a multi-layer management to control dengue.
Right, Doctor, as you make those opening remarks also talking about loopholes and challenges, but if you could also help us understand, we are picking up that dengue 2, the strain of the dengue is in circulation and is driving the surge in most parts of the country. Is that the case? What would you attribute it to?
See, whether dengue strain 1, strain 2, there are 4 strains basically, and currently 2 strains are more common. It doesn't matter which strain is there. We need to look at whether there is a dengue hemorrhagic fever, which is most dangerous, where there can be brain hemorrhage, and there can be platelet count going to 5,000 or 10,000. So you bleed with even blowing the nose, you can bleed. or just spitting, you can bleed. And in that kind of situation, we need to manage. So which virus is there, whether type 1 or type 2, whether it's a Bangladesh variant or West Bengal variant, I think for common man, it doesn't matter. For them, it matters is if they get the infection, they should go to doctor. Try and not get admitted, because you are also open to get hospital infections from there. So we need to avoid this kind of panicky reaction as soon as you get dengue.
Dr. Gilade, as you speak about testing as well, like they always say, prevention is better than cure. So before we wrap up this conversation, if you were to tell our viewers the top 2 precautionary measures that they should definitely be taking.
Number one, mosquito management. So see that your home is free of mosquito. In most people, if you have a home where you can put one window particularly with a net, so that whenever you need air, you open that particular part where net is there and mosquito doesn't come in. Secondly, if you are having a flower pots or anything where you are putting water and the water remains stagnant, see that you change water every day. Thirdly, you apply mosquito repellent, particularly to children, because we don't want children to fall sick and they get very easily into dengue, hemorrhagic fever. And lastly, if and when vaccine gets available, please take the vaccine.